I'm going to be speaking about, I have a lot of slides about how sleep can affect the risk for dementia and the risk for cognitive impairment, as well as how cognitive impairment and dementia disorders can affect sleep. And I will introduce those concepts initially and then later talk mainly about strategies for treatment. I hope to have time at the end to discuss your questions because that's always a very rich way to understand things and the complexity of them. And I look forward to answering your questions about any particular questions you might have. So we'll start here with why is sleep important? And that'll be the first part. I want to talk about how it's more than just rest, but there are actually physiological things that happen during sleep. And I think Dr. Deering will also discuss that on a cellular level, what exactly is going on. But these physiological things that happen on the cellular level can be important for preserving neurons and also enhancing memory and learning. When we do not sleep, there can be consequences such as failure to clear out toxins that may actually promote dementia. In addition, we all know that when we don't sleep, we have consequences on our behavior, mood, and other aspects of our well-being, and that's important as well. So sleep is more than just downtime. We need it. There are consequences when we don't get it, and there are things that happen during sleep that are important. The second part of the talk I'm going to talk about is what is commonly missed with sleep in middle age, in older years, or I'll mention that throughout this talk. And then also what can we do about sleep to make it better, the most important part of this talk. Consequences of sleep disorders are many, and there are many medical consequences of poor sleep, but we're going to focus today on dementia, mild cognitive impairment risk, and attention and memory. But you can see on this list, there's a lot of other things, including stroke risk, hypertension, death risk, depression, anxiety, emotional regulation, and other consequences of sleep disorders. The relationship between memory and sleep, which is what we're going to focus on today, has been more there's been more research in this area probably since the mid-1990s, so not a lot before that. But in this new research, researchers have been able to show that during sleep, there are physiological processes that actually help us consolidate what we have learned during the day. That means if we learn something and then we sleep, the next day we'll remember it better than if we learn something on one day and we don't sleep well. And I'll show you some examples of that. One of the ideas is that during the day, we get exposure to so many things. Our brain is basically on overload. And during the night, we need to pare down what's important and put into longer term memory the things that are important. If that doesn't happen, those important things do not get put into long-term memory. Sleep disorders are very common at all ages. But they're very common in older people as well. And this gives us an opportunity to really intervene to improve the possibility that we might improve our memory. Sleep apnea in particular is very prevalent. Maybe 60% of people over 60, that's more than half of people over 60 have sleep apnea. Sleep fragmentation is a very common problem, as you all know, and that has been shown to affect potentially how amyloid is deposited and might increase the risk for Alzheimer's disease. Sleeping too short or too long turns out to be associated with dementia risk, though there can be lots of causes for sleeping too short or too long that may be related to other things like sleep apnea and sleep fragmentation. And I mentioned that during sleep, we can clear toxins, and that may be part of the physiology of why when we don't sleep, we get increased risk for dementia. This is a slide showing the different parts of sleep. It's a little complicated, but the circle in the beginning is SWS, is slow wave sleep, and the circle towards the end is REM sleep. And this is This is the timeline at the bottom: midnight, 1:30 a.m., 3 a.m., 5 a.m., 6 a.m., 7 a.m. So in the beginning of the night, we have this deeper sleep, which is called slow wave sleep. At the end of the night, we have more of that dream sleep, REM sleep. And these different stages of sleep can be important for different parts of memory and different types of memory consolidation. In one of the very classic tests in the mid-90s, like I said, that's when this field started to really expand. They showed that this slow wave sleep in the beginning part of the night was really important for learning these pairs of words, like animal is paired with dog and bird is paired with eagle. If you get a whole bunch of these word pairs right before you go to sleep, and you get slow wave sleep, you do a lot better the next day. If you do those same pairs and you don't get slow wave sleep, but just REM sleep, you don't do as well. There are other tasks that seem to be benefited more by REM sleep that may involve more creativity and making new associations. So these different parts of sleep may be helping consolidate different types of learning. This is a really interesting study I'm just going to highlight. And the point here is that they learned how to discriminate a texture, to detect a texture. And if you were given this learning task and then you slept that night, you had better learning of this task that lasted many, many days afterwards. However, if you did not sleep the first night after learning this task, you got no improvement. And you never got improvement even later. So the point is, if you didn't sleep that first night, you didn't get the gains that you needed to help consolidate that memory. This is a very interesting task because you don't improve unless you sleep on this task. I've done some research using this task. And now I have two different studies I'm going to highlight. One is in children. I know we're talking about aging, but this is just about the basic physiology to point out that disruption in sleep at all ages can affect people's learning. And in kids in particular, they're learning a lot of skills in school. They're establishing their identity. I think it's really critical for them to have optimized sleep. And what this study showed was that in 300 kids, I think this was in the Chicago area, that were not performing well in first grade, they were at the 10th percentile for their class. They screened them for sleep apnea, which disrupts sleep. And they found that the kids the next year, if they were tested, those that got treated for sleep apnea improved to average performance. The ones that had sleep apnea and did not get treated remained at the 10th percentile. And the ones that didn't have a sleep apnea as a cause for their sleep, or they didn't have a sleep problem to explain why they might have problems, also didn't improve. So it was a very dramatic finding. And it always reminds me how important it is for all ages to get good sleep, and kids as well. This is one in older adults. This came out, was also highlighted in the New York Times back in the day in 2013. And what it showed was, again, these word pairs, when you're trying to learn new things, bird and jubu, in this case, were being paired together in a whole list of these little sounds and words. During the day, old people, average age of 72, so not too old, but older people and younger people were compared, and they both learned these pairs just about the same. However, at night, the younger people did better the next day. They had more savings the next day compared to older people. So why didn't the older people get the same benefits of sleep? Well, the reason turned out to be how much slow wave sleep they had. And you can see this line going up here that correlates with how well people did based on how much slow wave sleep they got. And remember, we talked about that as the deep sleep. So again, they're showing in older people, if you have more slow wave sleep, you started to look more like the younger people. And that was also related to the amount of volume in the frontal lobes. So now let's talk a little bit about maybe the risks of these sleep disruptions and its effects on dementia or cognitive impairment. So the things that I just told you were more about the concept that, hey, sleep is important for memory and learning. And we can see this when we're looking at people who are old or people who are young, and we have principles of understanding why this relationship occurs. But now we're going to look in people who actually have cognitive impairment or dementia and looking at these conditions and how does this increase the risk for cognitive impairment and dementia. Just to kind of back up about Alzheimer's disease, since it's the most common dementia, that's about 75% of dementia. 2% at age 65 might have this condition, but 50% of people over 85. So this is a common condition. 1 out of 10 over people over age 65. And the strongest risk factors for Alzheimer's disease are age and this ApoE genetic risk factor. The pathophysiology, just to quickly summarize, is this deposition of amyloid plaques and then later tau proteins. And this is a long evolution, this physiological change, the plaques starting 15 years sometimes before you even develop symptoms. And maybe if we affect sleep, we might be able to slow the process of these plaques accumulating. And that's kind of the types of studies I'm going to try to demonstrate, provide for you here. So this is, there are about 4 studies I'm going to highlight before we get into the practical things. This was a really interesting study, a retrospective study. Anyway, what they found, I'm just going to jump to the chase, is that people got mild cognitive impairment 10 years ahead of time. They got it 72 years old as opposed to 83 years old if they had sleep apnea. Okay, so it seemed to be that sleep apnea increased your risk of getting mild cognitive impairment earlier. Okay, now one of the things about that is if they were treated for sleep apnea, then with CPAP, that difference became much less. So with CPAP, it looked just like the people who did not have sleep apnea. The point being there that maybe if you get treated, you don't have that increased risk for mild cognitive impairment. This is another study that was done in women who were older. It was part of a study on bone fractures, and they tested for sleep apnea, and the starting age was 82, so quite an older age group. And after 5 years, if they did have sleep apnea, they had a higher risk of developing mild cognitive impairment relative to if they did not. And that was a 1.85 odds ratio risk, okay? This is another study where they found that for every increase in severity of sleep apnea, they had a 40% greater odds of an abnormal mini mental status exam. And again, this was in an older group of about 82. This is a study that I think was really great by this Dr. Lim. And he looked at sleep fragmentation with this sort of measure that he had with movement. And this is looking also with the ApoE4 genotype. And if you have 2 ApoE4s, you have a higher risk for getting Alzheimer's, as you may or may well know. But anyway, what happened was if you had these E4 genotypes, if you had good sleep, and you had the E4 genotypes, your risk for getting dementia went down to the same level of risk as other people who did not have E4. So that's pretty amazing. Now, there are ways you can understand this because it could be that people who didn't get dementia didn't develop sleep problems, but it is quite noticeable that if you had this high risk and you slept well, you didn't get the same dementia risk. It also had this poor sleep also affected the rate of cognitive decline and also was associated with amyloid deposition and the neurophysiology that you saw later, the neuropathology. This is just another study I will skip over, but again, I guess the point of this is that you can see the amyloid in these PET scans, and they found that shorter duration and poorer sleep quality in this Baltimore study in community dwelling people with a mean age of 76 was associated with increased risks of amyloid deposition if you didn't sleep as long. And this was a meta-analysis looking at the risk of sleep apnea causing increased risk for cognitive impairment. And you can see all these little balls and squares show a slightly increased risk with sleep apnea. The quantity of sleep, if it's too long or too short, seems to be associated with increased risk for cognitive impairment. And again, sleep quality increased risk for cognitive impairment. That one limb is the one that I highlighted there. It's sort of middle of the pack in terms of sleep fragmentation being associated with increased risk. So why is it that sleep is affecting dementia risk? So it might be that sleep affects memory, but why should it affect the physiology of dementia risk? And so what we found, or some studies have shown that amyloid deposition, that abnormal protein deposition in Alzheimer's may be promoted by reducing people's and mice's sleep. Initially, this was studied in mice, and you can show in all these very elegant experiments that were published in Science and Nature that if you sleep-deprived mice who were genetically engineered to develop amyloid, they deposit more amyloid than if they sleep normally. So if they don't sleep enough, they deposit more amyloid. The other thing that was discovered is that this might be related to the fact that when you sleep, there's sort of a hydraulic system called the glymphatic system where there's more ability to clear out the spaces and fluids in between the cells when you sleep. And this allows the body to clear out amyloid. So I'll just pop up a few slides here to show you how this amyloid gets cleared by sleep. And here you don't have to look at the details. This is a very famous study, but you can see these little dots going up and down. That's the amyloid going up and down. And during sleep, every one of us, all of us, our sleep causes our amyloid to go down. And then when we're awake, it causes our amyloid to go up. Okay. Now, if you sleep deprive mice who are getting amyloid, you can see on the left column here, the little black spots are amyloid plaques. But if you sleep deprive these mice for 21 days, look at all the amyloid plaques that they deposit. Okay. And the black lines up here in the column show how much amyloid are in all these different parts of the mouse brain when they've been sleep deprived versus when they're not sleep deprived. 1 night of sleep deprivation blocks your amyloid from coming down. This is a study that was done just to prove that that's the case. People who, not people, but mice who don't sleep at all, they also have more amyloid deposition even when they're genetically engineered not to sleep. And they wanted to show that was the case, not just poking the mice all night, which might make them not sleep for other reasons and cause problems. But even when they're genetically engineered not to sleep, the amyloid still accumulates. And this is a depiction of that hydraulic system, the glymphatic system, which is very much increased when we sleep, that allows potentially the clearance of toxins, including amyloid that was demonstrated in these mice. I should also mention that fluctuations of amyloid up and down in the spinal fluid have been demonstrated by a group at WashU. It's happening in people too, and this glymphatic system has also subsequently been demonstrated in humans, not just mice. Then there was this huge excitement about sleeping away amyloid plaques, and it was in the news. The sleep is the brain's housekeeper, and cleaning during sleep, this concept of cleaning out amyloid during sleep. One of the things to mention, and I'm sure you're all familiar if you're familiar with people with cognitive impairment or dementia, that sometimes sleep is worsened by dementia itself. So say you have dementia and it causes your sleep to be more fragmented, then that in turn could cause you to get more amyloid disposition and more dementia. So it's a big circle, as you can see here. So you could ask which came first, the chicken or the egg, but we think both of them feed back on each other. And we do know, and I just want to point out, it's not just that sleep disruption causes dementia. We do know that dementia and amyloid deposition can affect some of the sleep mechanisms, and that's why we have to be more careful about supporting them in the context of these dementia and cognitive impairment conditions. So this is where I'm going to transition to talking about practical steps. And I do feel like basic principles can really help people implement some interventions that can have a big difference on people's sleep and everybody's life. So if you live with somebody who has a sleep problem, it affects your life. And as we know, the consequences of not sleeping just the next day can be mood, can be lacking in attention, irritability, less emotional resilience, poorer memory, in addition to potentially worsening the progression of a dementia process or potentially increasing risk for one. So taking practical steps could have really big consequences. And I guess my passion is all about how basically everyone should know about these practical steps because they can have such a big impact. And I'm hoping I can tell you some things that might actually be something that you could be aware of and be able to implement in your own life or that of a loved one. Sleep complaints in general are very common. And what we're going to talk about is problems falling asleep, staying asleep, and also excessive sleepiness. You can see here, just in the regular population, 25% of people can have problems falling asleep. Almost 50% have problems staying asleep. But, you know, most people do not seek treatment by a doctor. And I would argue that most doctors are not even really well informed about how to intervene for treatment of these conditions. 10% of all people also meet criteria for a more serious chronic insomnia disorder. And in my opinion, these can often be treated without using medication. So again, we're going to talk about problems falling asleep, problems staying asleep, problems feeling tired or sleepy in the daytime, and then some sleep disruptors and sleep disorders that need specific treatment. This includes restless leg syndrome and sleep apnea, and I'll also touch upon REM behavior disorder. So to understand how to intervene with sleep, I just need to introduce a couple of concepts. When I talk to people, I talk to them about how we want to improve natural sleep drives. And there are two basic natural sleep drives. One is the circadian rhythm, this clock in your body. And the other one is the homeostatic sleep drive, the sleep pressure. To start with the circadian rhythm, I want you to know that every cell in your body has a clock. Your liver cell, your gut cell, your pancreas cell, your bladder cell, and your brain cells. But every cell in your body has a clock. And this is sort of in a 24-hour cycle, a little bit more, a little bit less. And if you can think about that, it's important that for all these clocks to be in sync. So for example, if you have jet lag and you fly to Europe, you might know that you pee at the wrong time. You start to have to get up and pee more often at night. You may pee anyway here in the States at night, but when you go there, it'll be even more. The other thing you might notice is that you feel nauseated. That's because your GI system is not really ready for food at the time that they're giving your food. So and you can even take a blood cell out of the blood and you can measure in every person their own circadian clock in that blood cell. You can look and see if that person's on an early phase or a late phase or how long their clock is. So it's very deeply ingrained. And you can imagine if we're going to sleep at the wrong time and waking up at the wrong time and all of the clocks in our body are not aligned, it could have a lot of consequences. So the circadian clock is a very profound rhythm, and getting that in sync is one of the purposes of these interventions I'm going to highlight. The homeostatic sleep drive is something that really helps everyone improve sleep. And the point of that is it's sort of like hunger. If you haven't slept for a long time, you get more and more sleep pressure. This is related to the accumulation of a particular compound in the brain. So the more you don't sleep, the stronger your natural sleep drive is to sleep. Okay, think about that, because if you take a nap at 2 o'clock for an hour, your sleep drive will not be as strong at night. This may be fine if you have no trouble falling asleep, but if you have trouble falling asleep, you may want to make that nap shorter so you have an increased sleep drive. The other thing is, if you're having trouble with that sleep pressure, you may not want to stay in bed as long because you need to build up the hunger for sleep during the day. Okay? So let's go on. Those are the important principles about the natural sleep drives. Let's talk about problems falling asleep. And basically the principles, I know this is a very busy slide, for understanding what to do in any particular case is to know the person's circadian preference. Is this person, yourself, possibly, a night owl or a morning lark? Okay. You don't want to force people to go to bed if they're a night owl too early. And you don't want to force people to get up if they're not a morning lark. Okay, you need to find out what the right rhythm is for that person. If somebody typically goes to bed at 2 and gets up 11, that's okay, but you want to work around that schedule, okay? You also need to know what a person's sleep need is, and this is genetically determined oftentimes. One of the problems is that we're told that we all need 8 hours of sleep. This is the average, but some people need less and some people need more. And I often ask people when they were sleeping well, say when they were in their 20s or 30s, or sometime they can remember what was their sleep pattern at that time. And they might say, well, at that time, I used to go to bed around midnight and I would get up at 7. So then you know they're more like a 7-hour sleep need, okay? So you need to determine those two things in order to best determine a good rhythm to help improve the natural sleep drives. The other thing you need to watch out for if you're having trouble with sleep is any stimulants that could be interfering. So everything we do with natural sleep drives can be torpedoed if you're taking caffeine or a stimulant. Now, if you're a person or your loved one is a person who sleeps great, this is not an issue for you. But if there's a problem with sleep, in the context of improving things, we completely eliminate caffeine or tea or soda or things like that. And we go over it very carefully. I could give you lots of anecdotes of nursing homes where they were giving people tea at night and they thought it was decaf, but it wasn't. You know, tea and coffee at night is really a problem. You certainly don't want to be getting tea and coffee at night and then requiring a sleep hypnotic just because you can't sleep. If people have hyperarousal tendencies, which is maybe about 10 to 20% of people physiologically, and you're more sensitive to these things as you get older, all these caffeines and stimulants can affect you even more so. Also, I think I mentioned earlier, what can work against your sleep drive is naps or dozing, and dozing is common. If people are having naps or dozing, I tell them they shouldn't be they should limit their naps to 20 minutes with an alarm. Naps are okay, but just limited and before 2 p.m. And dozing, you might want to have the lights up a little bit higher and not be on a real comfy chair in the evening or do interventions to avoid dozing. It's not always possible to control all these things, but I'm just giving you the principles. Also, it's something that works against your sleep drive. If somebody says, oh yeah, I wake up at 7, but they actually don't go out of bed till 11. So extending your sleep too long in the morning can also affect your sleep drive. Then you want to look for things that are disrupting sleep, and that could be like restless leg syndrome or sleep apnea. The other thing is important is getting exercise and getting outside during the day. And there's some general things that I have on this list, like not drinking food or fluids 3 hours before bedtime, and that has to do with your GI system needing to be on the right clock. You want to wind down time off electronics. You want a cool bedroom and a quiet bedroom and preferably no TV or clocks in the bedroom. What do we do after, what's the most important thing to do for improving sleep to get your circadian rhythm in sync is to set a sleep window. So remember how I said you asked somebody, when did they sleep great when they were 30? They went to bed at midnight and they got up at 7. So what you do to start off with to improve somebody's sleep is have them wait to go to bed till midnight. Okay. They can go to bed anytime after midnight. And then they have to have boots on the ground at 7 a.m. If this is the case. Now, another person, it might be 10 p.m. And then they could have boots on the ground at 8 a.m. You can vary this window, but you set a window so it gets set and you're on its sync in a very regimented way. So you don't stay in bed too long and you don't go to bed too early. And this really helps treatment of insomnia. It's more effective than medications. And so it's very important. You put this window around your sleep need, and and in your circadian rhythm, whether you're a morning lark or a night owl, and you fit it in there, and this is very effective. What I say is, it's sort of like you have a hall pass to go to bed at the first time. You have to have the hall pass. You have to wait to go to bed till the bedtime. And then in the morning, you have to have boots on the ground by that time. Now, it doesn't mean you have to go to bed at midnight. You could go to bed after midnight. You could go to bed at 1, at 2, at 3, or 4 in the morning. And it doesn't mean you have to get up at 7. You could get up earlier. The point being that sleep has to be inside the window you set in order to get everything in sync. It's a very important principle, and it basically fixes insomnia in most cases. We're going to talk about dementia and sleep disruptors, but this is a really important concept. The other thing I talk about is mindset tips. People start to get worried at night. If they have a bad night, it's important to remember that the next day may be fine. They are not always correlated. And also that we cannot make ourselves go to sleep, that we're not responsible ourselves for our sleep, it's a physiological process. So we want to work with these natural sleep rhythms. And if you follow these rules of waiting to go to bed by a certain time and getting up by a certain time, that's what you need to focus on. And it's not something that you can make yourself do on your own. Yeah, the other thing I mentioned to people, that it's fine to rest comfortably in bed and be a little bit aware of what's going on. If you're relaxed, that has restorative value. You don't need to get up and leave the bedroom unless you're frustrated or worried. There's often people say you have to get out of bed if you're not sleeping. You can stay in bed and be relaxed as long as you're relaxed, and that's good for you. And you don't need to leave the bedroom unless you're getting kind of hyped up or worried. Then you do want to go to the outside the bedroom to relax. And that's resting comfortably in bed inside your sleep window. You're not supposed to have a clock visible. That engages certain parts of the brain that interfere with sleep. That includes looking at a cell phone. If you get up to use the bathroom, don't be looking at the phone, and just go back to sleep, and you'll have an alarm set for your morning wake time. You don't need to check the clock at night. Okay, those are probably the top tips. The other thing I do is set expectations. We can't fix sleep perfectly, and the goal of this sleep window concept that I'm trying to kind of tell you about is that it improves your sleep and it makes you go the right direction. Your sleep may not be perfect, but you might move in the right direction. And that's what we're looking for, is a movement in the right direction. I have a lot of success with this sleep window concept with people who've had insomnia for many, many years and tried many, many medications. So it seems kind of simple, but it's important and very effective. Again, there's the circadian rhythm and the sleep drive that we talked about, that we're trying to reinforce with these interventions. I wanted to mention about sleep disruptors, since that was on the list. All caffeine is a sleep disruptor, and it can have effects for 24 hours. So if you have somebody with sleep problems, you really do want to remove that morning caffeine. There's also supplements like Excedrin and protein workout supplements and Anacin that have caffeine in them. There's hidden sources of caffeine. Tea is a big source of caffeine, and decaffeinated coffee has caffeine in it. For example, decaffeinated Starbucks coffee has 25 milligrams of caffeine. That's quite a bit for people who are sensitive. Just one coffee in the morning may not be okay if you have sleep problems. It has effects for 24 hours. There's other sleep disruptors like medications. Since we're talking about dementia, donepezil and Aricept are commonly used for Alzheimer's disease. At night, about 20% of people can have insomnia and even hallucinations and vivid dreams from Aricept and donepezil. That's why typically specialists dose this in the morning and when there's sleep problems. Okay, that's important. Sometimes your endocrinologist says take your Synthroid at night. Well, if you're having sleep problems, that's not a good idea. And also don't wake up at 4 in the morning to take this medication. Sleep is important. You can take your Synthroid at a later time. They can adjust the dose as needed if there's decreased absorption. Beta blockers at night can also affect sleep. Steroids, SSRIs like Zoloft, sertraline, Celexa, they can affect sleep at night, and sometimes it's better to dose these in the morning. In general, I recommend, remember the GI system isn't really meant to be starting absorbing things at night. It's working more in the daytime. So in general, I suggest taking all vitamins and supplements and any medications that don't need to be dosed at night in the morning, okay? Some things very specifically affect restlessness and body tension, even though they're used for sleep at night. And if you have that restlessness and body tension or restless leg syndrome, things like amitriptyline, Elavil, Benadryl, which is at all the Tylenol PM and Advil PM, mirtazapine, often used for sleep, and hydroxyzine, which is Atarax, makes people sleepy, can actually paradoxically make people worse. So beware of those. In general, all opioid medications are very problematic, muscle relaxants and benzodiazepines, since these typically make sleep apnea considerably worse, and they also increase sleepiness during the day. Approximately 70% of people on opiates will have opiate-induced sleepiness, and certainly muscle relaxants can cause sleepiness. And I've even had people feel like they were developing dementia just because they were on muscle relaxants and got better off muscle relaxants. Benzodiazepines have to be tapered off slowly. But again, if you're on Ativan or Valium, or your loved one is, and they're not severely demented, tapering those things off and using these other principles may offer benefits. The sleep environment, quiet, dark, make sure that there's not temperature issues. People can be cold when they get into bed. You need to be warm when you get into bed, but not too hot during the night. Sometimes I suggest people take a warm shower and then, or put socks on, but not put heavy, heavy blankets on or you get too hot during the night. You want to be body warm when you get into bed, but let yourself be able to cool down during the night. You want to avoid disruptors like pets if you have sleep problems, no TV or electronics, and make sure you have the right kind of pillow. Alcohol is actually a big no-no for sleep. It worsens sleep apnea. It causes increased sleep maintenance problems. It's not good for dementia. So typically if we're dealing with sleep and also any kind of cognitive impairment, I ask people to taper off the alcohol for many reasons. It can worsen restless leg syndrome. And it also can be associated with some other consequences. Sleep aids like Ambien and the other hypnotics, Lunesta, may be associated with dementia risk, but it's not entirely clear. But if you can treat somebody without using these aids, it's certainly better. These can be associated with grogginess and falls. And it's better if you can to try to maximum strengthen natural sleep rhythms if possible. In large epidemiological studies, there are some studies that show that use of medications like these and also benzodiazepines may be associated with increased dementia risk in later life. I was just going to talk a bit about some of the medications we use in dementia and their effects on sleep. Once again, melatonin can be helpful for insomnia. I use this at relatively low doses of 1 to 3 milligrams because it does have side effects. Clonazepam, I do very cautiously, and I prefer to use melatonin. I typically do not use clonazepam. Namenda can actually help sleep. It's not a problem for sleep, often used in dementia. Cholinesterase inhibitors, you have to be very careful. In particular, Aricept or donepezil has more problems with sleep disruption, and it is often a cause for people to get sleep disruption, then get put on hypnotics. So ensure that Aricept is in the morning, and understand that Aricept can cause vivid dreams that are not hallucinations. We typically do not use Seroquel at night, but sometimes you do if somebody's more severely demented and all these other interventions are not working. I'm adding a few pointers here about staying asleep, because we were talking about falling asleep, but basically it's the same things that apply for staying asleep. You make a sleep window. What is your healthy sleep need? Are you a night owl or a morning lark? When are you going to place that sleep window? When is your hall pass to go to bed? You can go to bed later than that, but when's the earliest? When is your wake time? When do you have to have boots on the ground to help build up your sleep drive over the day? Look at the caffeine, because that causes problems with staying asleep. Are you taking naps in the day? Because you're running, when you can fall asleep, but then you run out of that sleep need or that sleep hunger during the night and you wake up. So if you're sleeping 2 hours during the day, you're not going to sleep but more than 4 or 5 hours at night, and that's why you're waking up. Are you extending your sleep in the morning too long? and then you're not developing your sleep need either. Other things for sleep disruptors are sleep apnea, restless leg syndrome, not getting enough exercise, getting too much food or fluids before you go to bed, and again, the quiet environment. It's pretty much exactly the same things, and you'll have these slides, I think, afterwards to kind of review them. So again, same things we talked about. The other things I would add to problems staying asleep is you want to make sure people don't have nasal congestion, even mild nasal congestion. Snoring could be sleep apnea. You want to get that checked out. Reflux, pain. I usually use Tylenol arthritis if there's pain issues, or a mattress topper for joint issues. And again, nocturia, it's really important to avoid water or all fluids strictly 3 hours before bedtime. For daytime sleepiness, this could be related to having a sleep disruptor at night, like we just talked about, apnea, nasal congestion, reflux, pain. It could be due to circadian rhythm problems, where people are going to bed very, very late, and then they're getting sleepy in the daytime. It could be due to medications. I mentioned opioids, about 70% of people, that's pain medicines, will have sleepiness. Muscle relaxants, very common cause of sleepiness. Of course, things like Valium and Ativan causes terrible sleepiness. Clonazepam and other medications can be causing sleepiness. Not enough sleep, that's not really commonly a cause for sleepiness in the day, unless people are just on a rhythm where they're sleeping the day and not sleeping at night in older people. Excessive sleepiness in the day is not due to insomnia in most cases. People who have insomnia have hyperarousal and they don't fall asleep during the day. So it's common for people with really severe sleep disruption sometimes not to fall asleep in the day. And so don't think that doesn't mean you need to think that they don't have insomnia. Okay, this is a picture about, I wanted to talk about treatment of excessive sleepiness. Of course, the first thing would be to remove medications. Make sure that that window is in the correct setting, and it's not being varied from day to day, getting up later, getting up earlier, taking naps. But in some cases of people with conditions like Lewy body, there can be and Parkinson's related diseases, there can be a primary hypersomnia that can be benefited by giving things like modafinil, and that's my usual go-to for a medication to affect sleepiness. But I do the whole sleep window, addressing sleep disruptors before I add modafinil. But I wanted to point out that that can be used, especially in people with Parkinson's spectrum disorders, with some considerable benefit. Okay, lastly, we have 3 different sleep disruptors I'm going to mention that require very specific treatment. Restless leg syndrome, or tension during the night, and body tension is very common. And about 40% of older persons can have these periodic moments of sleep. Now, you might notice that in a loved one, they jerk their legs, and it's usually like on a clock, like every 60 seconds. It's while they're asleep, they may not be aware of it, but it can be causing arousals and sleep disruption, as well as disruption of the breathing patterns. In addition, you can have sleep apnea. So these are different kinds of conditions that you might need specific treatments for. What do we do for this limb movements of sleep and restless leg syndrome? Periodic movements of sleep is when you're unconscious, you're not aware of them, but you have this movement every 30 to 60 seconds. Some people have restless leg syndrome where they have body tension. They feel like they need to move and they can't sit still. It's worse in the evening, and it gets better when they move around. For these things, they can be worsened by low iron stores and certain medications. So one of the things I check is iron and iron levels and see if people need iron supplementation. Magnesium can help with these patients or people, and also avoiding medicines that worsen restlessness, including Celexa, Zoloft, all the SSRIs and those type of antidepressants at night, and Benadryl can make that worse. And consider iron treatment, magnesium treatment, and occasionally we use gabapentinoid compounds for that. It's very helpful at low dose, like 100 to 300. Exercise is helpful. Avoid the stimulants like caffeine. Stretching the body can help. And again, gabapentin, this is sort of reiterating what I just had on the last slide. By the way, caffeine, alcohol, and chocolate can really affect this body tension problem in this condition. Sleep apnea is very common in people over 60, extremely common. It's important to treat. It's associated with all of these things we talked about earlier: hypertension, dementia risk, stroke, depression. It can be associated with increased urinary frequency. Sometimes when I treat people with sleep apnea, they're just so happy they don't have to get up to pee so many times during the night. And sometimes when people are older, we just think this is just part of aging, that we pee more at night or we have restless sleep. But in fact, these things can be treated. So don't overlook this possibility. And if there's a concern about sleep disruption at night, have a low threshold for getting a sleep study. Most people with sleep apnea are not sleepy in the day. So if somebody's not sleeping during the day, but they're having fragmented sleep at night, that can still be sleep apnea. Most people are older with sleep apnea are not overweight. It's more of a thing that happens where we have a relaxation in the back of our throat and the muscles become more relaxed. And this could be causing sleep apnea in older people. It may not just be insomnia. If you're having awakenings during the night, it may be sleep apnea. So restless sleep at night, a slight tendency to snore, and hypertension really make it quite high likelihood that you have sleep apnea. It causes awakenings at night, increased urinary frequency, some morning headaches, restless sleeps at night, and sometimes night sweats. There are different frequencies of the apneas at night. Some are mild, some are moderate, some are severe. But even when it's mild, it can have oxygen desaturations and arousals, and the number doesn't correlate with how much it disrupts your sleep. So don't be fooled by thinking, oh, mine is mild, I don't need to treat it. There are other reasons the number may come out mild that relate to how it's scored in the case of Medicare scoring criteria, where it might be severe according to other scoring criteria. So if there is sleep apnea, take it seriously, even if it says it's in the mild area. There's lots of treatment options for apnea. People get scared because they think they're going to have a mask, but sometimes we just do side therapy and nasal congestion therapy or dental appliance. And CPAP is a really good option in some people. And I have older people who are like, thought that they were just older and that's why they weren't sleeping well. And then finally they got treatment of sleep apnea and they were just so amazed that they have that much more energy and can do that much more things. This is a map of someone with sleep apnea where you can see the sleep stage is colored at the top. In the beginning, you see that pink part. That's the slow wave sleep, which I told you the deep sleep happens in the beginning. At the end is REM sleep, which is red here. You see much more REM sleep in the end. But you can see there's a line that says oxygen. It's going up and down, and there's all these little hatch marks with respiratory events, and the heart rate is going up and down. And they had 67 respiratory events per hour. They were put on CPAP therapy in the middle of the night. It went completely away, and the patient woke feeling wide awake and sleeping much better than usual. And you can see the oxygen stabilized. There's a lot of physiological changes. And again, you remember in those other studies, the people who had sleep apnea had increased risk for getting dementia and amyloid deposition. So this is a very treatable process with CPAP. This is the last topic I'm going to discuss, REM behavior disorder. It's one of the core features of Lewy body dementia. And it can start 10 to 15 years before dementia onset. But one of the things to notice about it is that people can develop it even just if they have sleep apnea. It's not necessarily REM behavior disorder, but people who have disrupted sleep during REM sleep, it could be caused by sleep apnea. So you have to get a sleep test to determine if it's actually caused by sleep apnea. It might not even be caused by a dementia process. This is the condition where people act out their dreams. It can be very dangerous at night. We have to talk about safety. They can choke or beat their bed partners or throw themselves into a wall and fracture their bones. It's different from sleepwalking, which is when people have their eyes open and walk around and do things. These happen very quickly. People kick and scream and yell and push and fight. The content is usually a fighting content or aggressive content. And after just a couple of minutes, they wake up and they remember dreaming, typically. So it's different than sleepwalking, where they wake up but they don't remember anything and they're walking with their eyes open. Sleep apnea can cause dream reenactment. Like I said, it could be sleep apnea, so you always want to get a sleep study to look for sleep apnea. And even if you have Lewy body dementia or Parkinson's dementia that's associated with REM behavior disorder, a third of those patients will also have apnea too, and treating that will also be important for helping their sleep at night. Medications can also promote REM behavior disorder or dream reenactment. Again, it's the similar ones to the ones that can promote sleep disruption. Caffeine, please avoid all caffeine. Chocolate. I had a patient who just took, if he took a couple of chocolate chips at night, he would get dream reenactment. So he always had to take medication if he ate M&Ms or chocolate chips. So avoiding chocolate, avoiding caffeine, avoiding these medicines that can increase motor activity, like the SSRIs, is important. And ensure safety. We typically have the wife or husband move out of the bed, take away the tables and the weapons around the bed until it's been treated well. Avoid alcohol, caffeine, chocolate, and treat apnea and limb movements, and they can be much better. And then we give a little melatonin that can go up to higher doses. Of note, melatonin does cause side effects. It's not benign. Klonopin is sometimes used, but I try to avoid it because it can cause worsening of sleep. Unless people absolutely need it. Oh, I'm sorry, worsening of dementia and cognition and sleepiness. So I try to avoid the ones that are depressants for the brain and use melatonin instead. So I think this is a lot that I gave you, but again, you can have the slides. I tried to discuss a lot of different things today. Sleep onset insomnia, sleep maintenance insomnia, sleep fragmentation, hypersomnia, and these sleep disorders. And hopefully from this, you can gain some ideas about how to approach improvement of sleep. And I want you to especially keep in mind the idea of that sleep window, and designing a sleep window that fits yours or your loved one's patterns to help consolidate sleep into a specific time frame that helps with the natural sleep drives. So there are consequences of healthy sleep. This improves our memory, creativity, learning, emotional intelligence, cardiovascular fitness, and potentially reduces our dementia risk for the reasons I mentioned. Having fitness about sleep is not typically about what medicines to use, but understanding the physiology helps you with principles that allows you to design a better sleep window, and avoid stimulants that can improve your sleep. Make sure that sleep is a priority. And one of the things that we can do along with exercise and diet for our brain health, be aware of sleepiness and driving safety. That's something I didn't mention today, but that's very important. And I suggest if there's something you thought of during this this talk that made you think about something you could try, just while it's fresh in your mind, think about implementing one or two things in your own life to see how it helps you. And to summarize, we talked about these different parts of sleep problems: restless leg syndrome, obstructive sleep apnea, and REM behavior disorder, and keeping sleep as a priority. I know that was a lot. I'm sorry to give you so much, but I hope you can review the slides, and I would very much like to take questions because I know all of you are dealing with different questions regarding sleep, and maybe in some cases, this topic, this more general, doesn't really apply to the question you had. So I'll be happy to take questions, but I think maybe Dr. Deering will speak first. If Dr. Deering's not here, I'm happy to take questions now, but it looks like he is here. Okay.
Heidi, we're going to go ahead and ask a couple questions now.
Sure, that sounds perfect.
And while they're on people's minds, and then we'll go ahead with Dr. Deering right after that. But one question was, how do you feel about daylight savings time? How does that affect our body, and especially for people living with dementia?
I think in the grand scheme of things, it is a minor problem. You know what I mean? We can adjust to an hour change in our light, in our physiology. The things that I mentioned here are much more important. It has become a political issue, whether we want to stay on daylight savings or not. And the people involved in the politics of this, you know, on the sleep side, say it's more important to have more daylight in the morning because we want to get people started earlier in the morning. But I don't think that that policy change is of importance in dementia. One thing about light, though, is it very important to get light during the day. In the context of cognitive impairment and dementia, the most important thing is to get high amounts of light during the day, say at 10 a.m. or 2 p.m. It doesn't have to be right in the morning, but to increase the amplitude of light exposure in the day helps signal to our body that this is the time to be active, and that will help set our cells on their clock so that they go into the dark period or the night period at night. Interesting question. I know it comes up in the news, but I don't think it's probably critical in most cases.
It just feels like it is.
Yes, right.
For a few days.
I much prefer to have light at night myself, which means permanent daylight savings, but the sleep people all say we need to have it off all the time. So I think it's sort of controversial.
So, another question was about people that have progressed along in their dementia and
Yes.
they tend to sleep more often.
Mm-hmm.
Should we let them sleep
Mm-hmm.
or should we get them active?
Yeah, this is a great question because I think it depends on quality of life for the person who's helping them and that person. So if they're napping during the day, but they're doing great in between their naps and they're sleeping fine at night and they're not on medications that are causing them to be slowed down, I don't think we don't have to mess with it too much. However, if they're sleeping a lot and not engaging and not getting social interaction and not getting up and not doing things, then it might be something to address. And what do we do if people are sleeping a lot? I think that we sort of shape that sleep window and the circadian rhythm like I was talking about. So you might want to contain sleep a little bit more, have the person go to bed a little bit later and get up a little bit earlier and limit the naps during the day, keep the lights on during the day, and try to promote that wake period during the day and the sleep period at night by saving up the sleep for nighttime. Okay. I guess the other things that cause sleepiness during the day are all the things I mentioned, these sleep disruptors. Does this person have restless leg syndrome? Do they need a little magnesium at night? Are they taking the medications at the wrong times that are causing sleep disruption at night so that then they're too sleepy during the day? So there's a lot of things to check into to make sure they're not disorders that we can treat that are causing the sleepiness. But if that's all not been an issue, and I've had patients like where they've got a serious frontal temporal dementia or something, and they go to bed at 8 and they get up at 11 and they're perfectly fine during the day. And maybe they take a nap for an hour and it works for the caregiver who likes to play golf in the morning and have some time during the day. There's nothing wrong with that, but I'm not treating that person with a sleep aid either. I'm not putting them on a hypnotic. Okay. The person with Parkinson's, I had a patient I gave a similar talk to, and he had Parkinson's disease in the audience. He implemented a sleep window for his fragmented sleep, and he got quite a lot of benefit just doing that. So sometimes that sleepiness is not a disease process. It can be helped by putting these sleep windows in place. That being said, some people needed that little kick of modafinil because the Parkinson spectrum disorders are associated with excessive sleepiness, and sometimes people get a boost from that. So that question, I guess it depends on that person's quality of life, the caregiver's quality of life, whether it's a problem. So you need to know if it's really a problem. And if it is a problem, then you look at all the factors that we kind of talked about. And it's multifactorial usually. There's multiple factors that you kind of address. I hope that helps. Any follow-up with that?
Thank you. That was wonderful advice. I think that we have some specific medication questions that maybe
Sure.
we can handle possibly even offline. But it sounds like we did get a couple questions about, I know you touched on melatonin and magnesium. If we were going to try one thing first, should it be the melatonin first or should it be something else?
And again, I guess I'm looking for the cause of the problem. So if it's somebody who has body tension, if they've had a sleep study and it shows that's limb movements, I would definitely look at iron and magnesium as a first line thing. Okay. If somebody's acting out their dreams or fighting, melatonin is a great one to add. Okay, it's very effective. You could do both, really. There's nothing wrong with adding both of those together because they don't have a lot of side effects. If somebody has a lot of limb movements and restless leg syndrome and it doesn't respond to magnesium, there isn't an iron issue, I'd probably give them that little bit of dose of gabapentin to help with sleep. Even though it's a medication, it's not quite as strong as hypnotics. It's also about when you ask, would you do magnesium or melatonin or which first or when, I sort of hesitate and I think, but I would take away all the things that are causing the problem first. Okay, so you take away the caffeine, take away the tea, make sure people are getting exercise during the day and light during the day and they're not taking long naps before even giving magnesium or melatonin. You definitely want to see if you can remove those sleep disruptors. So it's sort of like doing that checklist first. You don't want my poor lady who was so distraught about her sleep, who was at this nursing home, discovered that she was getting caffeinated tea at night. Before giving her magnesium and melatonin, we just needed to get rid of her caffeinated tea. But I do like melatonin is not so much of a problem, just not 10 milligrams and not the compounds that have other things in them with them that can become problematic. I see a few things about Klonopin. Of course, Klonopin helps sleep, but it does have some increased sleepiness and can affect cognition. And so all these things like Balsamra, I think if you know more about sleep, and you would probably do all these other things first. So I'm sort of informing people that there are other things to do before considering Balsamra and clonazepam. And someone said that they had donepezil for sleep. Donepezil is Aricept. It has benefits for anxiety and people with Alzheimer's disease, but it does not help with sleep. You can use it in the morning, okay? And I wouldn't use it at night. Sleep causes 20% of people get insomnia with it, and it also causes vivid dreams in quite a lot of people. But it could be very beneficial for the cognitive issue. Okay, so that might be something that's helpful. Let's see, I've got looking a little bit at some of the other
We have a request for you to see someone in your
sure.
office.
I always feel like I can help everyone. I mean, every single person could be helped by
We all want
the
to come and
sleep.
visit now and learn
Yeah,
more about our sleep window.
yeah. But I appreciate all the questions because, happy to answer questions at the end if there's more time to.
Yeah, we will
Or
definitely
even
do that.
you can, they can send me questions later as
Okay,
well.
we're gonna go ahead and shift to Dr. Deering, and if you can stay on, Heidi, if there's more questions at the end,
Sure.
we would love for you to be a
Happy.
part of that. We did an introduction. Dr. Bazzoki did an introduction of Dr. Deering earlier, but we are excited to have him join us today and to talk more about the dementia and sleep research that he's doing and beyond technical